You know, ladies, we often talk about hormone replacement therapy and how important it is. But you know what? It's not just for the ladies. Guys, you might need it too. I'm at Tutera Medical and I am joined by Steve Nunn, who is the Associate Medical Director here. And Steve, let's talk about menopause. One of my favorite topics.
Oh, okay. Very good.
But, you know, we talk about menopause for women, but men kind of have their own menopause, right? It's called andropause.
That's correct.
What is the difference between the two?
Well, for women, menopause is inevitable. There may be a 4 or 5 year transition, but eventually their ovaries are going to cease functioning and they'll go into complete hormone withdrawal. For men, it's a more gradual process. We start losing our estrogen at the rate of 1 to 3% starting at age 30. So at age 60, you may have only lost 30% or you may have lost 90%. But the point is it declines. Men will reach a point most of the time where they're going to need hormone replacement therapy also.
Okay, let's talk about some of the telltale symptoms. We know, ladies know what to experience or what to expect and what they experience. What about guys?
Well, for men and women, actually, the testosterone deficiency symptoms are a lot alike. So there's issues with short-term memory. Why did I come in this room? Having good decision-making capabilities, clear thinking, level moods, not getting your buttons pushed so easily, being irritable for very little reason. Energy, huge one, getting through the day, getting through workouts, getting results, recovering, going back for more. And the last one is libido. So men and women will feel the same. Since guys only get testosterone, they're going to feel those a lot more.
All right, let's talk about what you do here at Tutera Medical, how you help couples, we'll call them men and women, whether they're together or not. But you use the Sotopelli treatment or method is what you call it. What is unique about that?
Okay, well, the Sotopelli method was really patented and developed by Dr. Tutera. And what's really unique about it is the individualization of pellet hormone replacement for each patient. So we use pellets that are individually dosed per patient. We can vary our dose up or down by about 10%, and it's specific for that patient.
Okay, let's talk about pellets, because I think people might be having a hard time wrapping their head around it. What is exactly a pellet? So you have some here. Show me what they look like.
Okay, so we have some pellets. These are actually some female estradiol pellets.
And these pellets go where?
They go into the subcutaneous fat in the hip area, where they're absorbed from there, either in men or women.
Okay,
and then,
so those are for women.
Those are for women. This is a single male pellet, which you can see is larger.
Yeah.
Men require about 15 to 18 times more testosterone in their system to be able to function. So their pellets and their doses are much larger.
Okay, so the Sotopelli method, we'll call it, is the compounding, if you will, of pellets specific for us, and then how they go into the body. Is that right?
Well, pretty much, yes.
Okay.
So the pellets are compounded by a FDA-approved compounding pharmacy. We figure out the dosage, we individualize that for you, and then we monitor that.
So couples have come in here, couples therapy you call it, literally, come in here together. What do they tell you after they have experienced some of the effects of their hormone replacement therapy?
Well, quite often I'll hear something like, "You saved our marriage." Many times as time has gone on, their intimacy in the bedroom has just really stopped. Neither one of them has interest. Many times a woman comes in, she gets her life back, she's feeling great, and hubby's over there being the couch potato.
Yep.
Occasionally he's drug in here, but other times he also figures it out and comes in on his own.
All right. Well, you're saving marriages as we speak, so we appreciate that, Steve, and we also appreciate this. Receive $30 off a new patient consultation along with insertion. Tutera Medical is located at 8412 East Shea Boulevard, Suite 101 in Scottsdale. Call 480-874-1515 or visit the website tuteramedical.com.